Holohan.
Thank you, Mr. Chairman, for the invitation to present to the committee, and good afternoon, honourable members. On behalf of the Canadian Counselling and Psychotherapy Association, or CCPA, it is my pleasure to be here today to discuss our recommendations to support the federal government in its efforts to increase productivity and competitiveness in the Canadian economy. CCPA is a national bilingual association representing the collective voice of over 6,200 professional counselors and psychotherapists. Our association promotes the profession and its contribution to the mental health and well-being of Canadians. Investments in areas related to mental health and mental illness are vital for the general welfare of all Canadians, particularly given that mental illness will impact 1 in 5 individuals in their lifetime. Despite the incidence of mental health issues in the general population, people with mental health needs face multiple barriers accessing services. These barriers, in turn, result in adverse consequences for the Canadian economy. In 2011, the annual productivity impact of mental health problems in the workplace was estimated to be over $6 billion. The key to any successful business is its workers. By ensuring employees have access to the services and supports they need, businesses can maximize productivity and competitiveness. We believe the following recommendations will assist the federal government in addressing barriers related to the accessibility of mental health services. First, CCPA recommends that the federal government include counselors and psychotherapists as an eligible expense in the public service healthcare plan. We understand that mental health claims account for nearly half of all health claims amongst federal public servants. Including counselors and psychotherapists as approved service providers will increase access to those in need and can have a positive economic impact as well. Wait times for mental health services are a considerable problem, with potentially negative consequences for those seeking help. Adding counselors and psychotherapists to the mental health care continuum will reduce wait times, increase early intervention, and minimize the need for specialist care for preventable chronic conditions. The need for more expensive treatments down the line can be reduced, resulting in long-term savings in our healthcare systems. I would like to emphasize that CCPA is not suggesting that counselors and psychotherapists replace other mental health professionals. Like many of our health and mental health partners, we advocate for appropriateness of care, access to the right care from the right provider at the right time. We believe that the addition of a fully qualified resource makes appropriateness of care more attainable. Second, CCPA recommends that the federal government reinstate Canadian Certified Counsellors, or CCCs, to the list of approved service providers for Health Canada's First Nations Inuit Health Branch programming in provinces that have not regulated counselling and psychotherapy. The decision to remove CCCs has significantly reduced appropriate universal access to mental health counselling services for Indigenous peoples across the country. Given CCPA's collective body of work specific to Indigenous mental health and the rigor of our national certification program, which has been in existence for over 30 years, we are confident in requesting the reinstatement of CCCs as approved providers of the NIHB counselling benefit. Their reinstatement would support and help Indigenous communities, families, and vulnerable individuals by increasing the availability of services and expanding the number of service providers. Finally, we recommend that the loan forgiveness program for physicians and nurses be extended to university graduates of counselling programs. The program has worked wonderfully for providing incentives for graduates to work in rural, remote, and northern regions of Canada. We feel that should the government extend a similar program to university graduates of counselling programs, this would attract and retain these much-needed professionals in communities that are at high risk with limited mental health services. The federal government could also consider grants, scholarships and bursaries in exchange for a return of service commitment, wage incentives, a guaranteed minimum income, and/or tax credits for practicing in remote areas. Access to mental health care is a priority shared by federal, provincial, and territorial governments, as recently articulated in the Common Statement of Principles on Shared Health Priorities. We strongly believe that our recommendations will contribute to the common goal of improving access to mental health services and supports for Canadians and their families. Thank you for your time and attention, and I would be happy to take questions.
Thank you very much, Kim. Canadian Medical